Morning, guys. Lovely day out there today. I hope you get an opportunity to get outside and spend some time in the sun, either before or after you watch this video. It's a tricky one where we're up to now because we've looked a little bit at World War One and World War Two, but we also do need to cover a section of the specification on liberal government and public health changes and reforms. So every time I'm using the word reform in this video, remember I'm talking about changes and the government actually trying to improve the nation's health for really the first time. Now I know there are some key reforms underneath which you'll have heard about and done a little bit of work on beforehand, and what will revise also in year 11 and in year 10. But the Liberal government here that we're going to look at today is the start of the 1900s and the build up to World War One, and the government begin to take a little bit more responsibility now for people's health. So the first task is obviously jot down the key learning question about how did the Liberal government improve public health. Now the word Liberal, if you get confused, is just a political party. So we may have a Conservative government now, Labour government when the NHS was set up, and a Liberal Democrat government in the early 1900s. So that's why it's called Liberal Reforms, because it's the political party in charge that put these changes in place. So the starter is about significance. It's one of the questions that comes up on the exam. And we always talk about impact, don't we? Every time there is a question on the exam, it's the 8-mark question about significance, and the word significance is in the actual question. I always tell you, when that question comes up, you must use the word impact in your answer. Impact on medicine, or impact on public health, or impact on treatments or causes, whatever the question's asking you, we're wanting to know what impact this event has actually had, immediate and long term. So have a go at the starter, press pause. There's some key reforms underneath. Chadwick, remember a bit about Chadwick's report. Public Health Act, actually putting something in writing, some laws in place but actually not compulsory. The outbreak of cholera itself as the disease that killed so many people. The work of John Snow when he removed the hand of the pump to find out how cholera was spread. Pasteur's germ theory, and the final actual Public Health Act. Okay, that was introduced, making sure medical officers were in and around each place. Conditions in streets were improved by fining people, by sweeping streets, by actually introducing dustbins, by putting Bazalgette's sewage system underneath the Thames. So that act put lots of things in place to try and improve. It was the first point really where they tried to improve the public health of society, the health of society. So have a go at that. Draw yourself a line with a ruler, and I'll just be interested to see where you plot things. If you look at the thing on the left hand side where it says struggling just here, you can actually see you can't be wrong. You know that with significance. You can never be wrong. Just justify and explain why you've picked what you've picked. So press pause and have a go. Okay, just letting you know where we're kind of up to. Kind of in this area, we're going to be looking at Booth and Rowntree today, and two people who you're going to learn a little bit about today who were part of these ideas for liberal reforms. Rowntree, as you know, is from York, and those of you that have been to York sometimes, from the Rowntree's factory where they produce chocolate. You can sometimes smell that near the factory in York. Okay, so how did the role of the government actually change? So really, during the 20th century, the government's role had a massive shift in how much they were looking after public health and doing. We know before they had this laissez-faire attitude, but now they were more actively involved in ensuring the health of the population. Some people will argue that their role is up for debate because it depends on which political party you belong to. And it was the Labour Party that set up the NHS, and the Liberal government and the Liberal Party, Liberal Democrat Party, who started to try and improve the health of the nation after about 1900. We're going to have a look at costs involved to healthcare treatments and differences between different systems, but the government, in essence, got more involved, and they were worried about children's health. They were worried about children's health in local areas, and they introduced measures to to improve children's health. There were some reports by Booth and Rowntree which we'll look at, and these special investigation reports looked at the lives of poor people in cities. And one of them, Booth, looked at poor people in London, and Rowntree looked at poverty in York, and they had huge big reports on what was going on there, and used that evidence to give to the government. Free school meals were introduced for children because they were worried. There was a war just at the beginning of the 1900s called the Boer War, and soldiers came back from the Boer War, which was fought in South Africa, where they didn't do very well, and people signing up for the army at the time, many people were shocked about the condition that people were in physically. So there was an issue with that they had to get Britain fitter and healthier, and this understanding now that things had to change. So all of these liberal reforms helped different types of people. They also helped the elderly, because eventually there's some national insurance put in place where they're looked after as well, and given pensions. So lots of things to think about today, and you're going to be looking at a really quite difficult video in a minute that I'm going to play. It's really tough and really detailed, but I think it's going to be useful for you when you're looking at the role this government played at the beginning of the 1900s. So if you're drawing a timeline, you've got 1900s here and then all the way across to 2020. So we're now looking at the last 120 years, and obviously within that initial part you have got the First and Second World Wars, but before then you've got something called the Boer War. So the Boer War was actually, as I said, fought in South Africa and between 1899 and 1902, so it's 3 years long. Because we know South Africa was a British colony, British Army were there fighting against some indigenous Boers from South Africa who were trying to push for independence. 40% of these volunteers for the British Army were in such a bad state, health-wise, and their living conditions-wise, that they were investigated. And not only that, just before the First World War in 1913, we had workers just living on £1 a week, which is the equivalent to about £19 a week today. So you can see there's a lot of poverty, and women as well are often going without food, so the children and the men, the wage earners who need to be healthy, can eat. So a lot of poverty at this time in the early 1900s, which is beginning to be tackled by the government. Okay, so there's a grid here, a grid of questions. It would have been called video bingo this. There's loads and loads and loads of questions there. Okay, now what I would do if you could is I'll put this on show my homework, and maybe easy for you if you could print it out and cut it up and stick it in. That would be great. If you can't, it doesn't matter because the questions are still there, so you can note the questions down, and then we're going to go through the answers after the video. But there's going to be some simple one-word answers to these questions which give us a bit of an insight into the liberal reforms. The video's hard, guys. It's not easy, but I would really like you to bear with it and watch it because it's really useful. Okay, so press pause if you do need to print this out, or if you want to jot a few of the questions down, which I think is really important. Certainly for those of you that are really keen to get the top marks next year, because if a question like this comes up, some schools won't do it in as much detail as we are. But I'm going to show you one of the examiner's videos. It's quite nice on liberal reforms, and they are going to go into a massive amount of detail, so bear with it. Let's just ping it up on here. Okay, get the volume up. Off we go.
This presentation looks at the liberal reforms of the early 20th century. There were several underlying reasons why these reforms came about. There was the pioneering research into poverty by people like Booth in London and Rowntree in York. There was the German economic growth that threatened Britain's financial supremacy in Europe. There were the problems of finding fit and healthy recruits for the Boer War at the turn of the century.
Okay, so these are the reasons why the government take action. We're going to look at more detail about the research from Booth and Rowntree. Booth in London, Rowntree in York, into conditions in these cities. So we'll have a look at those reports in a bit more detail. But they're basically finding out 30% of Londoners, for example, are are so poor they didn't even have enough money to eat properly. And in York, he found 28% of the population did not have the minimum amount of money to live on at some time in their life. So it fuels fears that an unhealthy state of British workers could lead to a decline in the country, but also a decline in the country's industrial power, which is this bit here. So people are concerned that if they're not going to work or work in factories, then their economic and industrial growth and power is going to be less than Germany's. Army recruitment's a problem as well, because as I said earlier, when they go and sign up for the army, they take all the measurements, do all the fitness tests, and 40% of those candidates are really unhealthy and not very fit. As a threat of a new political party, the Labour Party at the time, so the Labour Party is standing up, their main aim is to stand up for the workers and the working rights. So they're threatening the Liberals to do something. And then we have this kind of new Liberal guy called Lloyd George. And actually, believe it or not, Winston Churchill was a Liberal at this time. So these kind of new thinkers are pushing new ideas to help people.
All of these combined with other factors and the threat of the new Labour Party, causing many Liberals, such as Lloyd George and Churchill, to advocate reform as a necessity to win over voters and to secure Britain's place in the world.
So remembering reform, all of this is about reform, which is change. Help children who are poor, help families who are poor, help workers, help kids at school, get into school, more schools, and help the elderly.
After the 1906 election victory, Henry Campbell Bannerman was Prime Minister for 2 years. But the key figures in the reforms were Asquith, Prime Minister from 1908 onwards, David Lloyd George, Chancellor of the Exchequer, and Winston Churchill.
This is politics. The level of detail here is not necessarily needed for a paper on medicine through time. They've just mentioned some key figures. So this is not as important as knowing about Louis Pasteur, or not as important as knowing the detail that you've got around John Snow or Chadwick. These are just people in charge at the time. So Herbert Asquith, Lloyd George and Winston Churchill. So you don't necessarily need to know all of that. I've just got the videos really detailed.
President of the Board of Trade. The reforms themselves spanned the years 1906 to 1912 and covered legislation around assisting vulnerable groups in society. Children, the elderly.
So those are the three key groups, and there's one more he's going to put in a minute. All of these forms are actually targeting vulnerable people. Vulnerable children who aren't able to eat and their families can't afford to feed them. Vulnerable elderly within society who are dying young and life expectancy is quite low because they're not protected in later life. The sick, because we haven't got readily vaccinations at the time and things are not being developed to make sure that people can prevent from getting disease. And then the unemployed.
And the unemployed. Legislation for children began with the School Meals Act in 1906. This provided for free hot meals to be supplied to children in school by local councils. Not all councils responded, but many did, leading to weight and health improvements for many children.
So first one, free school meals. Brilliant, because it meant that everyone could get food at school, which they maybe couldn't get at home at the time. So in the cities, it was a great move. So free school meals in 1906.
In 1907, school medical inspections were introduced, in which every child got a yearly medical check. However, any treatment required still needed payment until 1912. Then, in 1908, the Children's Act introduced a range of legislation giving children special status as protected persons. For the first time, child abuse, neglect, and ensuring children's lives became illegal.
So this is key. So not only do you have this school meals, school medical inspections, so you can check up on the kit and the condition of the kids, but also protecting them. So really three important big breakthroughs from the Liberal government. You know, if you bring in those types of things in, you're going to be respected.
child courts and ball stalls were established so that children would not have to attend the adult versions. For the elderly, 1908 saw the introduction of the Old Age Pensions Act. This was offered to those who were over 70 years of age at the rate of 5 shillings a week to single people and 7 shillings and sixpence a week to married couples. For many, it removed the threat of the workhouse and the fear of being reliant on their families.
So, for some people who could actually get access to the Old Age Pension Act and get access to some money, it meant that at an old age you weren't forced to going into work. Or they weren't being relied upon by the families, weren't having to provide for them. However, as it's going to say...
But you had to have lived in the country for the past 20 years.
Yeah.
You had to have less than £31 a year to qualify. And it could be refused to those who had not worked hard enough in their working lives. For the unemployed, the Labour Exchanges Act in 1909 set up places for employers to advertise jobs and workers to find them. This was a successful and useful...
So that's key, because it's a bit like the job centre. So now, if you were opening up a new factory, if you were a rich business person at this time in 1909, you could then set up a place for any employers to advertise in this place. And then if you wanted work, you'd go and look for the advertisement and apply for the job. So it's a slow start. 83 are set up in 1910, but it means people know where to look to get jobs. And also people advertising for roles need to know where to advertise.
Full measure, with 83 exchanges being set up in 1910 alone. For the sick, the National Insurance Act, Part 1, in 1911, set up an insurance scheme in which workers paid in 4pence a week, employers paid in 3pence, and the government added another 2pence. For this payment, when workers fell ill, they received 10 shillings a week for up to 26 weeks, and a 5 shillings a week disability pension if they were unable to return to work.
So this is the same today. You know, people pay national insurance, and this National Insurance Act is to ensure that if anything does happen to someone at work or even in their life, then they are protected. So the workers actually, as part of their salary, pay in 4 shillings a week to the scheme. The employers also pay into the scheme, a bit like a pension today. And the government add a bit as well. So in case of emergencies, people are protected. So it's ensuring them in case they're injured at work.
The National Insurance Act Part 2 in 1912 turned its attention again to the unemployed. It was aimed at helping seasonal workers, like those in the shipbuilding trade. For a similar payment into the scheme, when unemployed, those who belonged to the scheme could claim 7 shillings a week unemployment pay for up to 15 weeks. However, all of these reforms needed to be paid for. So how were they financed? Well, in 1909, David Lloyd George introduced what he called the People's Budget. In it, he introduced a raft of legislation increasing taxes on the wealthy, raising duties on tobacco and spirits, and introducing tax on the profit from selling land. Wealthy landowners, largely conservative, were heavily...
The People's Budget is key, because obviously if he's got this budget here, he then has ideas underneath, right, okay, if I tax the rich more, I'll get more money to pay for all this. If I get higher taxes on imports coming in from the Caribbean, like tobacco and spirits from where they're being grown, I'll get more money for this. If I introduce more tax on profit from selling land for rich landowners, I'll get more money for this. So he's taking and taxing from the rich to pay for the majority of the population, which is interesting.
Against these reforms. And the largely Tory House of Lords refused to pass the budget. This caused a constitutional crisis, which eventually led to the curbing of the powers of the House of Lords. This presentation has covered just some of the many reforms introduced by the Liberal government of 1906.
It has covered just some, and there are others that I want to talk about now. So hopefully that is a lot of detail. It's good. That's why I showed it. But let's just take a look at just here the actual lesson. I'll go back to that now so we can have another look. Okay, right. These questions would have not all been able to be answered, but we're going to go through them now. So actually, you have answers to these as well, and it'll give us a bit more information. So we have got, just moving on, resume slideshow. Okay. What were the main problems in public health? Well, it was the slums and the disease in the cities. What were the problems of new liberalism, this new Liberal Party? That they're limited in changing attitudes. They can't do everything themselves. What was the government's attitude to the poor? Well, before it was laissez-faire and they were trying to change. The countries, number 4, which British workers were not keeping up with, were Germany and America. We know that the war that young people needed to be fit and ready for was the Boer War, but they weren't. Who was helping the poor left to? Well, it's the wealthy and the charities at the time. And then Booth investigated poverty in London, and Rowntree also investigated the causes of poverty, but also poverty in York. National Insurance Act 1911. What type of social housing did the government offer? Well, workhouses to accommodate them. What were the main causes of poverty? Age, unemployment and illness. Who sparked the first set of reforms? David Lloyd George. What did workers think about the National Insurance Act? Well, a lot of workers didn't agree with deductions from their pay, but they did feel the benefits, if needed, were too low. So they didn't see the end game when they retire, really. And the Act published in 1908 is the Old Age Pension Act, which people pay into, so when they can stop work, they still get paid. Who benefited from the Act introduced in 1908? Obviously pensioners. And what many types of poverty were found, primary and secondary. And what that means is poverty that is already there and poverty that is being created due to the conditions that society are living through. So lots to do. I liked the video when they focused on different categories and different people. But the significance of the liberal social reforms were high in preventing disease as well. So if you look at those diseases that we talk about, diphtheria, typhoid, vaccinations were created and medical officers would go into schools and try and stop kids from getting these diseases early. So the infant mortality rate was actually about 4.2% at the beginning, but slowly reduced to about 1.8% by the start of the Second World War. And it's all due to these social reforms that are put in place by the Liberal government, and on the back of the reports from Joseph Rowntree and also Booth as well, these reports where they're producing graphs to look at where people are dying of poverty, and giving more free school meals to the kids and giving free milk and so on and so forth. It slowly leads to this idea of a welfare state where they look at children, families and elderly as different groups and begin to improve education and for children and give free dental care and spectacles for kids, and the adults and the families and have free doctors and have training and pension schemes and family allowances and sick pay, and the elderly obviously get retirement homes and special pensions and people coming in to help them and meals for home and support with funeral costs as well. So there's a lot of different groups that are looked into and supported before we get to the NHS through these liberal reforms. Okay. This is a difficult source about liberal reforms, but I just wanted you to have a go at identifying 3 things you can see in the picture and then see if you can, in a bullet point, just answer the blue, red, orange and green box. Okay, this idea of new liberalism is new support for the poor. So interesting, and new ideas to support the poor. So have a go at that. Press pause and have a go at it yourself. Okay, and finally, bringing all of these reforms together, we know 3 different groups of people that it helped. You've got the elderly, number 1, or you can have a go at it yourself. Press pause and see if you can get the groups. Elderly, number 1, sick, number 2, toddlers and babies, number 3, and then the unemployed, number 4, the ones that are going to work and want to work. So that's a start in knowing the groups that it affects. I'm actually doing interviews all day on Friday, so I'm going to be in 7:30 preparing, and then starting at 8 till about 5-6. So it's going to be a long day, which means I'm not going to be able to do the live lesson. So what I will do is probably do a follow-up video on Friday, so you have this one and another one as well, just to keep you ticking over. But like I said, we're in a position where we're going to finish medicine before the summer, and then revise and go through it all. So keep working hard. It's a tricky lesson, this one, because there is a lot of detail in that video, but an important lesson. Okay, thanks, bye.